Hi everyone, my name's Laura Simmons. I'm the CEO and founder of Theratrak. I'm also a paediatric occupational therapist and I'm the moderator for today's session. So firstly, as I've said, happy World Occupational Therapy Day. It's super exciting to be part of this incredible profession and thanks everyone for joining us. I'm super excited to hear, as I said, where you guys are all from. Super cool that we've extended the barriers across Australia. So welcome to today's session on the future of health tech and tips to successfully embed technology solutions in allied healthcare. We hope that you find this session to be full of insightful conversations, real world tips and tricks, and we'd love for you to get involved as much as possible. I'm super excited to have all of our panelists on board today. They bring with them a wealth of industry experience and real world knowledge, and I can't wait for them to share it with you. I want to say a big thank you to General Assembly for hosting us. For those that don't know, General Assembly is a pioneer in education and career transformation. They specialize in today's most on-demand skills in the technology industry. So a big thank you for supporting the future of technology and careers here, especially in Australia. So to start off with, I'd like to acknowledge the traditional custodians of the various lands on which we're all attending from today, and the Aboriginal and Torres Strait Islander people participating in this webinar. I'm hosting today from the Gadigal of the Eora Nation, and I'd like to pay my respects to elders past, present, and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the land and the waters of Australia. So a bit of housekeeping before we kick off. We'll start today with a few intros from the panelists to give you an idea of who they are, and I'll stop talking. And then we'll kick off our panel discussion. And as today's topic suggests, we'll be looking into the future of technology in allied healthcare and really digging into some practical things that practice owners and therapists can do to really embed technology in their practice. Please feel free to engage us in the chat. I'll keep an eye on it. Put any of your questions in the Q&A function as we go along as well. I'll make sure to keep 10 minutes at the end where you can ask any of these panelists any of your burning questions. And I'm pretty sure not too much is off the cards, so we'll be cool at the end. All right, so myself, and then I'll stop talking. Hey everyone, I'm a paediatric occupational therapist and like I said, also the founder and CEO of Theratrak. Theratrak's a digital platform that enables any allied health professional to create, monitor and track custom therapy home programs for their clients and then track their progress from a distance. We're a mobile app and a web-based platform that works with therapists in sessions to capture and digitize meaningful information from a therapy session and then send customized notifications to keep their participants on track. We're live in an Australian market. We're also live in the US market as well. We've got over 400 therapists that use our platform, and to date we've supported, I checked this morning, over 1,700 participants with home programs, which is pretty awesome. But that's enough from me. I'll hand over to Jack. Jack, can you tell us a little bit about yourself?
I can. I'm a physiotherapist, don't hold that against me. And I'm a clinic owner myself, but these days I spend most of my time helping other clinic owners. So at Clinic Mastery, we help allied health professionals to grow their clinic from physio and OT all through the allied health spectrum, helping clinic owners to lead inspired teams, create amazing client experiences, and ultimately build a clinic for good. And so I get to work with hundreds of health clinics to amplify their impact. It's a whole lot of fun.
Awesome. We're so excited to have you here and share your knowledge because I think you've got so many insights from all the different practice owners that you've worked with. So I'm super, super excited for that.
Thanks for having me.
No worries. Mel, can you tell us a little bit about you?
Absolutely. So I'm Melinda Weber. I'm an occupational therapist of about 20 years. So yeah, a little while ago since I graduated, but in that time, I have developed Southwest Kids Clinic, which is a pretty large multidisc clinic in Liverpool sort of area, southwest of Sydney. We've got OTs, speech, physio, therapy aides, and as of this morning, we have a dental hygienist joining our team. So a nice, well-rounded group of allied health professionals, which is fantastic. We love technology in our clinic, and it's something that we do a lot of, and we really embrace change and get excited by, the ability to use evidence and innovation in our practice. And I'm also joined Jack's team as a mentor through Clinic Mastery, which I've also been a member of for quite a number of years.
Awesome. And you're a phenomenal OT. You forgot to add that part in. Phenomenal OT. I'm so excited to have you on this panel, Mel. You definitely downplay all of the cool things that you do. So yeah, everyone, let's pick Mel's brain because she's got so much knowledge in this industry. Awesome. Yianni, lucky last.
Thanks, Laura. So my name is Yianni Serpanos. I'm founder and CEO of CorePlus, which is a digital health clinical information system. It is focused on allied health and has a mission to connect, help and grow the allied healthcare community, and particularly to develop a modernised healthcare model, excuse me, using digital first thinking with digital health innovations. I'm also the founder and executive director of a digital health innovation community called HealthTechX, which aims to bring innovative healthcare providers, health tech developers, subject matter experts and investors together to solve problems in the healthcare industry, particularly where there are gaps where we can build out an ecosystem of interoperating tech that can actually help practices modernize. And I sit on a number of working groups and committees with the Australian Digital Health Agency, advocating for conformance around the ability to share healthcare data between systems and connect different points of care. And I host a podcast called Reimagining Healthcare.
Just
I'll pause there, Laura.
Just a couple of things I was going to say. I have to keep everyone to time. But yes, Yianni, I'm so excited to have you part of this panel, especially around your lens of innovation and tech and how we bring the two together. So I think this is a really unique panel that we've got today, bringing in both industry in allied healthcare guys that are on the forefront of everything when it comes to practicing and providing therapy, but also from the tech lens as well. And I think bridging that gap between tech entrepreneur or tech founders and therapists, which I guess I sit in the chasm in between being a tech founder and a therapist, but bringing these two things together, I'm super excited. So I will stop sharing my screen so everyone can see all of your lovely faces. And what I'm going to do is I'm going to jump into my first question, which is around the trends. And I think, Yianni, I'm going to throw this one to you first, but in terms of trends, what are some of the biggest trends in the health tech industry, especially in allied health, that are impacting us as clinicians and therapists right now? What do you think are some of those big trends?
Well, I would say, look, it's consumer expectations, really, in terms of how they want to interact with the healthcare system for whatever reason. The world's constantly changing. We've certainly gone through a lot of change over the last couple of years, and that brings with it different needs and different requirements. So the demand profile, I guess, for Australians and how they want to be able to stay in touch with healthcare would definitely be a trend in my view. I also think from a technology standpoint, there's quite a pervasive and general acceptance now of using technology, which is great. Sort of 10, 11 years ago, when I was starting out with CorePlus, we really struggled with the idea of what was cloud and where was the data. So we sort of live in a world now.
Cloud?
Where is the cloud? It's somewhere up there. And the data is certainly not under my desk anymore. But I think there's a very strong trend now to be embracing technology and putting clinical systems in place, as well as thinking through some of the digital touch points that kind of add maybe as an alternative to traditional communication systems. So traditionally phone calls were used a lot in order to ring a practice and make bookings. And a lot of practices still rely on that. But there are a lot of people now who just want to make bookings electronically. So doing online bookings and submitting forms and doing some of that intake and post-appointment stuff is very universal and growing very fast at the moment. So I'd say they're probably the more pragmatic trends that I'd point out.
Yeah, and I think that's really interesting you point those things out, because in everyday life, that's what we do, right? We book all of we reserve our tables at restaurants online. We do all those things, and it's interesting in the allied healthcare space that we're catching up. I mean, Jack, from your perspective, as working with practice owners and things like that, has that been something that's kind of been a pull and in demand from therapists? And sort of, are there any other trends that you've been seeing from practice owners?
Yeah, it's funny you mentioned that demands from therapists. To answer your question, I'd say the trend that we get to see is the way we work is shifting from how we work as therapists, using things like Theratrak, or looking at CorePlus being that information system, whatever it might be. The way we work as therapists is so tech first these days, or it needs to be towards tech first. But even on a bigger picture, the way we work, integrating telehealth perhaps, is really changing the game. Working from home, right? I think for those of us who are clinic owners, we're going to be having to wrestle with this idea of how do we create a working arrangement that embeds tech so deeply and richly that it enables people to work from home or remotely. There are so many ways in which we work that will need to shift because of the richness of technology that's available for us.
Yeah, so true. And maybe, Mel, from that, how was it? I mean, we sort of, I think as a therapist, we jumped onto telehealth. I mean, we've been doing a little bit of it pre-pandemic, and I didn't want to touch too much on the pandemic, but how was it for because I know you're in Southwest Sydney, which is pretty highly impacted. How was it for your therapists to jump on that train of telehealth, and really sort of jump on that trend? How was it?
Yeah, I think for us it wasn't too bad because we have a really young, energetic team who are excited by technology and excited about, thinking outside the box. So for us, it was something that we embraced and we jumped on it really early, and putting in place some really good systems to help support the team. So for us, it was a nice transition, and we had really great outcomes from doing online sessions. And so it kind of motivated us to be able to do more and more of it, and to continually create and think outside the box for our families. So we embraced it and loved it.
Yeah, that's so awesome. And that kind of leads me to my next question, which is about the actionable stuff, right? So it's something that we get asked a lot, is how do I put Theratrak into my organization? How does that training system work? Or how do I embed, and that's pretty much where this panel came from, is how do I embed that technology in my clinic? So it's not just an app that I've purchased or a platform that I've purchased that sits there and nobody uses, or people use only the high level stuff. And I think I'm gonna spin this backwards. I'm gonna start with Mel, and then I'm gonna end up back at Yianni, because I think the tech lens of this will be really cool. But from Mel, and I know we talk about tips and things like that, are there some specific things and processes that you guys do at Southwest when you're bringing in a new piece of technology or a new system or process?
Yeah, definitely. I think the first thing that we do is really understand what the frustrations are for either our clients or our team or individual therapists, and work out from there what solutions we can use, and if it's technology or if it's something that's a bit low tech for us to use in our practice. I think sometimes we get a bit excited by some bright and shiny things that other clinics are using without necessarily thinking about if it's an actual, I guess, solution that we need for our clinic. So the first thing is to look at what our frustration is, and then look at what the solutions are available for us to be able to use that. And then we sort of have a bit of a system to make sure that we're getting better efficiency, that we're getting better outcomes for our clients, that we're, ticking off all those boxes to know that it's a solution that really meets our needs within our clinic, whether it is for our clients or for our therapy team or our admin team for that matter as well. For us, then what we tend to do is have, a clinic champion. So somebody that we can have to trial the equipment and can give us some feedback and use it maybe with a few clients and get feedback from those few clients before rolling it out to our whole team, so that then we can know, is it the right technology that we've picked, or is it something that we need to pull it back and then trial something else in place of that. And then in terms of, once we've picked that bit of tech that is just gold for us and that we know is going to make a big difference, for us it's about having a team meeting and really leaning into the solution that tech is going to help for our clients or for our team or our clinic. And then, putting in place some systems and some training to be able to make sure that we're all trained up and using it in the same way, and we're getting consistency with that technology. So,
awesome.
Yeah.
Awesome. How do you find a clinical champion in your team?
Yeah, good question.
Is the clinical champion always the team leader? Or as totally a loaded question, because I know the answer to myself, but I want to hear from your perspective. How do you find that person, and how do you choose them?
Yeah, for us, it is generally a team leader. And the reason for that, as opposed to, say, myself, is because I've reduced my clinical load and I'm not treating so much these days. So definitely for us, I don't think it necessarily needs to be a team leader. We've just chosen that because in the past, when we've introduced tech, it just sort of has evolved that way, where that's been the most suitable person. But I think in terms of how I would choose that going forward, it would be the person that has the ability to analyze a tech that we're putting into place, or somebody that's currently having those frustrations that can then see if that's helping to solve those issues or those pain points within our clinic.
Yeah, totally true. And then if I was to throw that back on you, Jack, as someone that is working with, multiple practice owners, and I'm sure you get this question a lot, what tech do I pick? And how do I pick a piece of tech? Everyone says I need tech in my life, but I don't know. And you Google case management software system and hundreds come up, and you Google whatever it might be. How do you help a practice owner decide what's right for them? Because there's so much out there.
There really is. I think having a really connected team is an important piece of that. To loop back to Mel's point there, you want to have an ambassador, a clinical champion that is going to test out that tech and is trusted amongst the team as almost an independent person or independent party. Because sometimes for us as clinic owners, our team might wonder, what's our motive, or is this financially driven, or they don't know. But if it's one of them, they're much more likely to adopt it amongst themselves as a team. So I think that's really important. And if you're struggling who to choose, often the youngest is a great one to choose, because and that's no disrespect to those with more experience, but often the youngest, they're used to fiddling with tech. And the beauty about tech these days is that more often than not, you can fiddle, you can test, you can trial, you can dip your toe in the water. You can reach out to founders of these softwares, and the support network that these platforms provide us is incredible. The ability to customize and to lean into tech support and to add feature requests to software that you need is so readily available. So where do you start, Laura, I guess? Well, it's different for every clinic owner, right? So there's many ways to be right. I would say the only mistake that you can make is not starting. We don't need to necessarily dive straight into the deep end, but staying dry is not going to get us anywhere. It might be dive in the deep end, or it might be to dip your toe in the water. So where would I start? I think things that make your therapist's life easier is a great place to start. There are some technologies that are phenomenally powerful, but sometimes a little bit complex or hard to wrap your head around, or they're quite time intensive, at least in the early stages, to set up and get going. So my advice would be, if there's something that you can implement that improves workflow of your therapists, improves their efficiency, decreases their admin load, decreases their follow-up load, so they can spend more time doing the things that are meaningful, doing the things that they love, that type of tech integration is going to yield some nice early results, some low-hanging fruit that then might enable you to take the next step and the next step towards some of the more comprehensive tech solutions.
Yeah, no, that's awesome. And I mean, one of the things that we know with Theratrak as well is that sometimes there's time to adoption as well. So there's that sort of lead in time of, I found this problem, I know I need to solve it, and then I, for example, pick up Theratrak, and then they try it out for a month and everyone's kind of sticky with it, and the team is kind of working through that change. And then there's kind of this, for us, there's always an aha moment, and everyone goes, oh, totally get this now, this is what I'm doing and this is where I'm at. Do you find that with other pieces of technology and other practice owners that you've worked with, is there sort of like a time that you should give it? Like, I think there's never an overnight thing with changing a team's processes and things like that. Yeah. But is there a time frame that clinicians should sort of keep pushing through? Or like, when's that cutoff where you're like, this isn't working for me, I need to try something else? Because that's okay too, right?
Right. To quote, I don't know if it was a prime minister or just a politician, you've got to give it a fair shake of the sauce bottle, right? You've got to give these things a crack. And I'm actually curious, Laura, folks, if those listening, attending here, want to jump in the questions or the comments, the Q&A section, I'd love to answer any of your questions and be super practical today. But you do have to give it a good shake, Laura. But what I would say is sometimes that can feel really daunting for team members, especially those who are maybe tech hesitant, to paraphrase a common colloquialism these days, or a little bit even tech resistant. Those who are a bit unsure, an open-ended commitment can be a little bit scary and daunting for them and create a bit more resistance. So what I would say, I think it's really practical for clinic owners to put a time period on that trial. And I would say you've got to give it 3 months at a minimum. 4 to 6 weeks is just often not enough. By the time you set up logins for your team and, customize a bit of the back end and the way the UX looks, you need 3 months. But say to your team, what we've seen clinics do really well is say to your team, this is just the trial, and if it doesn't work for us, we'll scrap it and we'll go back to how things were. But if it works, you're going to thank me later. And so what it says to your team, it says, well, if this doesn't work, we can go back to how it was, which is a win. Or if it does work, we'll integrate it going forward, which is a win. So it's a win-win solution. It decreases the risk for your team to have to adopt it. So give it a good shake, a good 3 months or so, and then be willing to go back if needed, but let me tell you a secret, you rarely go back. Tech is amazing these days, and almost every rollout of tech that we watch, people will look back. And here's the thing, right? If you're thinking about it, people often look back and go, oh, well, that wasn't so hard after all. Mel, I don't know about you, but it's like, oh, geez, I wish I did that months ago. I wish I did that years ago. What have I been waiting for? But you don't know that until you give it a good crack.
I think it's also the case of then you sort of think, oh, well, what did we do without it? What were we doing before we had this?
So true. I think that's we get the comment, oh, that wasn't so scary, when someone sends a home program for the first time, and it's like, oh, okay, that wasn't so scary. We're all good. We can keep moving on with these sorts of things. Now, Yianni, I'm going to flip this on its head and go from a tech perspective, because I think this leads into my other question around this, and I know this is something that CorePlus actually has in their system around the trial period, and I know it's something you've probably designed for because of that onboarding onto technology. But from a technologist and from a technology company, are there some things or practical steps that you would suggest to a practice owner who's wanting to try out a practice management software system for the first time, or they're frustrated with something that they're already using? How would they go about working with the technology company?
Yeah, sure. First of all, a lot of good points just in the comments that were just made there. I think before I kind of go into my answer, I'd also respond to that former question by saying that tech is not a silver bullet. It's very powerful. I call it canned culture in a sense. When we design software, we're heavily engaged with our customers to understand their goals and aspirations, not just their goals and aspirations, but also the customer's goals and aspirations. So from the point of view of what you're getting yourself into, in principle is you're kind of adopting, at least at this point in time, what perhaps most of your peers think is a reasonable set of features and functions to be able to support workflows in your business. So you can make that assumption. But I think you also need to think about what are your goals and what are your clients' goals. And the more you understand and empathize with that, the more you can then answer the question, once you sort of say, what do I need to do? Why do I need to do it? Then you can introduce the how. And the how will be a piece of health tech or another piece of technology that will actually help you achieve that goal, or help your client achieve their goal. And I think it's a really important relationship to keep. I think that to your comment, Jack, about younger people, yes, very enthusiastic to take on new technology, but that's usually because they're not indoctrinated into any pre-existing culture. So there's a lot more flexibility and dynamics in general. I'm generalizing in younger people to just subscribe. Let's try this. But that also brings with it the potential for disruption as well. So I think, where are you at with your clinic? Are you at startup phase? If you're at startup phase, it's greenfield. You can bring in everything new and build culture based on the products that you actually introduce into the practice at that point in time. Whereas if you're a more mature healthcare business, large workforce, more established quality systems in place, you have to be careful not to throw too much new stuff at it, because you then dilute your culture, you dilute the quality of your system, which can also make it a little bit uncomfortable for people when there's so much change going on in the process. What we focus on is we look at what we call CX, or customer experience. And it's a framework that you can apply in healthcare. You could call it patient experience, you can call it client experience, whatever terminology works between you and the people that you're supporting. But the idea is, what kind of journey are they on? And how are they going to interact with you in a seamless, safe way that makes it really easy and simple for them to engage with you and achieve their goals in the process. So that kind of framework has been embedded within our businesses, and we make sure that we kind of simplify it conceptually. So I'll give you sort of a simple pragmatic example. When you think about a typical journey that a customer takes these days, and this is not specifically to CorePlus, but just sort of generally, we usually go through a research phase. So if we sort of understand what is a research phase for your client, how do they do that? Is it via Google? Are they going to another healthcare provider who is likely to refer to you? It's a matter of sort of understanding what is that research phase. When do they come across then to engage with the service? So in our case, we offer a trial experience to support the research phase. So at that point, somebody is actively considering some kind of goal or set of goals that they're hoping to address. And so when they're introduced into our product set, we don't put a timed trial on it. We actually provide an untimed, in our industry, it's called a freemium service, which means you can use it for as long as you like, so that you can get through that research stage and feel satisfied that your goals are going to be met and achieved. And we did that through our own research, because we observed that with allied health practice owners and people who are representing those practices, that it's kind of a bit of a mixed bag, 50-50, let's say, in general terms, where some people will get through a trial experience in 30 days or 14 days, but others won't. And so kind of knocking people out of the trial just because they're not ready didn't make sense to us. So we just thought, let's just leave it for as long as that person or practice needs, in order to feel satisfied that it's going to help deliver the goals. And beyond the research stage, we have two other phases that I'll talk to before I hand over. One is what we call an onboarding stage, or in health terms, it could be an intake process. We have a similar kind of mindset, and it's about how do we help you bring your information in and get yourself set up. We have a customer success team that is there to help you in person or online. It's online, but in person, as in like this, as opposed to sending you emails and chat notes, for example. That will really help you answer the specific questions, get the right settings set up, get the right information in the system. So we want you to succeed. And that's why we call it customer success. We want to make sure we understand your goals. What are your aspirations? How do we get you achieving that as soon as possible within the product? And that's usually the one or two leaders from within the clinic who are going out and doing that research, whether it's the young member of the team, whether it's a team leader or a clinic owner. But the next stage, we call it optimization. And that's to make sure that the whole team, your whole team, is able to embrace the features that the researchers went and found on behalf of everybody else, to make sure that everybody can now take advantage of that functionality.
Yeah, and I think that's so important, Yianni. And I think if we take it back to Mel, around like sort of with your clinicians and things like that, how does that work from a practical sense? And like maybe we can think about practical example. I'm shamelessly going to plug how we got Theratrak into Southwest Kids with this one. But from a practice owner, and I can tell the story, but maybe you can tell the story. It'd be interesting to hear it from your lens as well. How did that process happen? Because when we first met, Theratrak was a baby product, I would say. It wasn't even, I think, launched in the market yet. We were still very early on. How did you see that relationship and that's from embedding that piece of technology that, to be really honest, there were a lot of things that we needed to work on to get it to where it is now and where it will go in the future. But how did that look from your end as a practice owner and for your clinicians?
Yeah, I think we had for a couple of years constant conversations about, for us with Theratrak specifically, how we weren't able to help families to remember their home activities, or we weren't able to find a way that we could track each step with them and support them and provide them with maybe an extra phone call to support them in between their therapy sessions, or whatever it was that we were needing to do. Or we didn't have anything that was easy. We'd made notebooks that families could take home and write. We wrote down their homework, and we had very simple, I guess, strategies and systems in place to help our families, but there was lots of issues with families then, losing those books or not bringing them back, and just very logistic difficulties that we had, that there was no solution, and it was something that we had tossed up the idea of wanting an app or wanting a program, and we'd for us looked at things like the apps that they use in school classrooms to share communication between teachers and parents, but they didn't fit us either. There wasn't privacy built into that. There wasn't, ways for us to have kind of backwards and forwards kind of relay of information with parents. So for us, nothing fit, right? And I think it was actually for us when we were scrolling through Facebook forums or something like that, that I stumbled across yours and jumped on, and I think I sent you an email or a messenger message or something like that to reach out, because we were so keen to see what this amazing tech was that would mean that our therapists would be much more efficient with doing their home programs for families, and our families would be able to do it at the touch of their phones, because that's what all parents have it is the ability to have tech in their handbag or in their back pocket, and so for us it was really a great timing. I think you were in the infancy stage of your Theratrak journey, which for us was great, because it really meant that we could partner with you and give you, I guess, that group of therapists that could test the product for you. But it also meant that we could help along the process of giving you feedback as to what was working really well and what was, I guess, needing some tweaking. So we kind of had that little bit of input into how to, continually evolve it with you. And for us, that was just amazing, because we could literally tell you very frankly and genuinely what we needed. And you were so receptive to for us to, introduce those things in due time, and, as your technology evolved. And, for us, it was really that answer that we needed, and timing made it happen.
Yeah, and I think it sounds like there was a lot of communication in there, and I know there's probably a few private practice owners on here, and I actually had a poll at the start, so I might put that up in a second to find out where everyone works. I totally forgot. I got so excited at the start. But from a practical lens, we weren't catching up every 24 hours because that's just not possible. That's not going to fit into someone's life. We caught up every 3 months when we were able to do things in person, and emails and phone calls and all of those other tech things were things that helped us give that feedback. And I know, Yianni, if I throw back to you, I'm pretty sure, because I've used CorePlus quite a bit, but there's an upvote feature on CorePlus. Have I got that right?
We and this could be handy to think about in terms of the relationship with our clinics, clients as well. But we try and be very feedback oriented. What is it that our customer network needs now and into the future? And there's, as you can imagine, there's always a ton of ideas coming forward. So we have this kind of democratic process where we offer an ideas forum, that allows the community of users to actually see other people's ideas and say, oh yeah, that would be a good feature, or that would be a good enhancement, and then start to vote for it. And that starts to then bring it, to the top of the order. It helps us rank how to use our time and effort as best as possible today, in order to add value into our community as quickly as possible and help them achieve their goals. So yeah, I hope that answers your question, Laura.
Yeah, definitely. And I can see there that Sarah's put in something in the chat about how we find solutions. And I might throw this back to Jack, just because I'm sure this question gets asked to you a lot about, and we sort of touched on this before around, like, do you just Google it? Do you find a problem? Do you ask a friend? Do you go on Facebook? And there's probably 1,000 answers to this, Sarah, but what's the fastest point from point A to point B to finding that piece of technology that's out there? And are there any tips around that you can share?
For sure. You often don't know what you don't know in the tech space. Yeah, it's tricky. So it's hard to Google for things if you don't know what you're Googling for. So to Yianni's point, and I love that you can see everyone else's ideas. In my experience, clinic owners who want to go deeper with their health tech need to get around other clinic owners that are exploring tech. The people that you surround yourself with, the other clinic owners that are dabbling, that are trying. You want to be in a room of progressive clinic owners that are constantly pushing the boundaries of what it means to run a clinic. So that might be choosing which, when they come back, conferences and events to go to, or which podcasts you listen to, or things like today, which webinars you're on. I would suggest don't just attend, have a look through the attendees list if the guests can see that, because there's a bunch of other clinic owners and clinicians that are progressive in their tech approach and learning off each other. It's such a dynamic environment. So learning off each other, testing off each other is really critical.
I might jump in on there. In the chat, if you are from a technology company, can you put your technology company in the chat so people can see a list? Because that would be a really easy. I did see there are a few tech founders and health tech founders that have jumped on today. So if you guys want to jump on, put your websites in the chat. That would probably be really useful for people as well. I agree with you. Talk to people. Yeah,
talk to people. Probably the other two things I would say really practically is to think about things that you can improve your efficiency, or things that you can improve the client experience or the patient experience. So from an efficiency point of view, I know someone mentioned practical examples in the chat there. Things like MediPass, formerly known as HiCapsGo, but now MediPass, which is a cloud, whatever the cloud is, a cloud-based payment solution for us in our clinic, was a really practical example of how can we improve the efficiency of processing payments. And it was actually a really cool double-sided coin, because not only did it improve the efficiency of how we were able to collect money, but also it creates an amazing experience for patients, especially those that are private patients or having to pay up front and then seek reimbursement from other parties. What it means, it's like either going for a ride in the taxi where you have to swipe your card at the end of the night, and that's no fun for anyone, versus an Uber where you just get in and get out and you don't have to pay anything. It just happens magically. So not only was it efficient, it was an amazing experience. And so MediPass was a great example. Clients and clinics transitioning from paper-based notes, those still exist, believe it or not, to clinic information systems, practice management softwares that can improve the efficiency of your therapists and your admin. It's such easy, low-hanging fruit.
Yeah, for sure. And I think there's another question here in the chat that I've just seen from Alfred. And this is, I'll open this up to everyone. But are there useful apps with databases that can automate and recall client experiences? I'll shameless plug, Theratrak does recall, and we get feedback from therapists, from clients about their experience with their therapy activities. That's one, but maybe Yianni, Jack, Mel, you guys can all jump in on this. Is there any other platforms out there that you've seen that do client experiences?
I don't do well with silences. Yanni, go for it.
Yeah,
For it,
same. That's what I was thinking too. Look, CorePlus does support a chunk of the clinical relationship. It's a patient management framework. So online bookings, to be able to put that out to your website or your social media pages, for example, to offer a book now patient experience, intake forms to be able to make more efficient and automate and standardize the that first consultation, and then other communication automations that can be put into place to support a quality system end to end in terms of how you build that service proposition for your client relationship, claiming support, Medicare, DBA, private health insurance, EFT credit card for online payments, as well as in-clinic payments, NDIS support for gathering up and managing the drawdown on approved funds for participants, things of that nature. It's quite a comprehensive set. But where it falls short in any respect, we have a really large ecosystem of other health tech and tech add-ons that our customer network can choose from in order to really take into consideration wherever you're at. Are you a startup? Are you a 50-person clinic? There's going to be an evolution in terms of the different level of sophistication you need to run your business over time. And that ecosystem of add-ons can be turned on very simply and easily. And there are other products out there as well. We also support the telehealth framework. So that involves not just voice, video, and chat, but also collaboration online, and also very secure transferring of healthcare information through a telehealth interaction, as well as when you're needing to send or receive healthcare communication from other points of care. So it's quite a unique set of functionality where when you're needing to get a referral or submit a report to another point of care, you can do that completely securely and privately on what we call a private digital network, a digital health network. And that also provides a directory where other points of care can search, select, and send clients your way using a secure messaging framework as well. So yeah, there's quite a little bit of detail in the ecosystem and the add-ons. But yeah, I might just pause there and get some other thoughts into the mix.
I think
maybe
in terms of specific apps, Clinic Apps is one that comes to mind that sort of has that Net Promoter Score, and you can do those automated. If you've got clients in your database that have not got upcoming appointments booked in, that they can do those recall that are quite automatic emails that get sent out to families. So I know that there are also some of our practice management software where you can automate if a certain appointment is booked in to then send out. For us, we have a survey that goes out after a particular appointment type, which we've put in our own questions around feedback, so that we can get that kind of constant information from our families about the services that we provide. So yeah, there's a few.
And I think if I can jump in on that as well, I know a little bit behind the scenes, Mel. It's not only about automating, collecting some of that feedback and data, whether that's, you mentioned Net Promoter Score, for those unfamiliar, is a score of the likelihood of someone to refer a family or friend. It's essentially an experiential, objective measure. And so not only do we want to automate the data collection of that, but then also nurture based on their response. So if someone gives you a 9 or a 10 out of 10, often your PMS or Clinic Apps will be able to then take someone down a particular route. Maybe they can provide a non-clinical testimonial or review, or vice versa. If they're not happy, you want to be able to pick up on some of those negative experiences and be able to turn them into a positive. So you want to capture that data and then automate the nurturing of that process. And similarly, for clients who slip through the cracks, which happens all the time, right? Maybe kids get sick or patients go on holidays, whatever that looks like, they drop out of care for whatever reason. There's often interruptions, and being able to make sure there's a tech-enabled safety net so that clients can resume their therapy and get the complete and remarkable therapy solution that they deserve, means tech can create that safety net and re-engage them back in care. I think that's a really important piece to consider. And I know someone mentioned in the comments there, like, what's the tangible outcomes? What's the result of that? Well, first and foremost, primarily, it means that our patients and clients receive the care that they need and deserve in a timely, consistent manner. But on the flip side, there's also a commercial reality to it. Yeah, it means that our therapists are well utilized in their diaries and not patchy or not peaking and troughing, and their billings or their remuneration, their reward structure is up and down. When we use tech like client experience first tech, it means our therapists are more consistent, and it also means, from a business point of view, our cash flow and often profitability is improved and increased. Which, of course, for those of us here, we generally want to help people, right? So it doesn't mean we get to line our pockets and send our kids to private school. It means we can reinvest back. Those things are important. We can reinvest in new tech, yeah, and roll out more amazing features for our clients. And so using tech to improve profitability means greater reinvestment back into tech in your practice.
Sure thing. And I think Alfred has just said he wants to jump on the chat. So we're going to have a live question, team. Alfred, are you there?
Yeah, I'm a retired public health doctor, 85 years old, worked overseas for UNICEF, etc. Came back to Australia about 12 years ago. Recently started a company called Sing with Fred, using song to connect with loved ones with gratitude and care to make them happier and accepted. But part of that is a database for behaviors in the past that are recalled and made people happy, that they can recall whenever they like, and it's to do with behaviors that it's based on time, person, place, basically. Mm-hmm. So if you're feeling a bit down, or if you want to recall something happy, you can mention a few words and the AI will direct you to that occasion. And I'm wondering if this could be related to client behavior in terms of them recalling their own behavior systems that can reinforce your therapy.
That's awesome. Alfred, I think you've led us straight into the future of health and my future questions, which I might hand this one straight over to Yianni, our innovator on the call. Even though we're all innovators, Yianni loves talking about the future, and I think this would be a great question for Yianni.
Thank you.
No worries.
Yeah, thanks for the question, Alfred. As you were sort of sharing that kind of vision for that application, I thought of Google Photos, and I'm sure Apple has an equivalent, which does have an AI in the back end and does some really interesting stuff by looking through, which may be controversial for some, but looking through your history of photos, which really are documentation of your sort of life's experience up to that point in time, and it does these things where it puts it into hey, 1 year ago, 2 years ago, 3 years ago, or it might reference a birthday or a relationship that you've encountered in more recent times. So I'm wondering whether that's what you're trying to evaluate, whether there was some kind of product in the market that could be used for healthcare that does that. Is that the case? Oh, Alfred's disconnected.
It started off working with music therapists using a tune or a song to get back to the past. And I've already had 3 Zooms with friends working on this. But the song is an entry point, and there are other entry points. But the recall points could be photos, as you've mentioned, videos, poems, little stories, whatever. So it's a whole different world that's fascinating. And I just wanted to share that with you.
That's awesome. That's awesome. That's really, really cool what you're doing. And I think that's the crux of health tech, right? So if I think about what we're all doing with the tech founders that are sitting on this call as well, Yianni, yourself, myself, and I'm sure there's a bunch of others on the chat, which I still would love to know where you're all from. I saw one, but I haven't seen any more. That's what we're doing, right? We're solving a problem. We see a problem in the market that maybe it's a social problem, maybe there's a social outcome, but at the end of the day, we're trying to solve problems for people. And I think that's really important. What I might do, knowing that we've only got 10 minutes left, I'm going to put up my 2 polls in here to find out who's on the call, where you're at. But whilst you guys are answering those questions, I'm going to throw it back to our panelists around the future, which is the title of today's talk. And we're going to spend the next sort of couple of minutes talking about the future. And maybe from some of the panelists, is there something interesting you've seen from a technology thing, a product, an idea, a company that you've seen that's doing something super innovative, different, changing the game? I'm going to throw it over. Maybe Jack, do you want to jump in first, and I'll put up these polls?
Yeah, sure. Thank you, folks, for contributing to the poll. It'll be some really interesting and useful insights. I think when it comes to the future, right, Laura, and what we need to do as clinicians and clinic owners, and permission to speak directly, we need to consider how we can put ourselves out of business. Like consider, or put a different way for those maybe less commercially minded, how can we make our profession defunct, right? What are the opportunities that are going to potentially squash OT, right? And how can we find solutions around that? A really easy example to consider is Blockbuster, the video and DVD shop, right? They didn't think about it. They just stuck in their lane. And as we know, Blockbuster doesn't exist. DVDs don't exist anymore. Netflix does. And so how does that play out in OT land? What is that like? Is it something that another profession's doing that you can learn from? I think clinic owners who get outside their own bubble and learn from other professions is really valuable. And even beyond health, right? Is there something that you can learn from hospitality or tourism? Yeah, some really experience-first industries. Is there something that we can learn from the software space in how they manage teams and recruit, right? Because I don't know about you, but almost every clinic owner is struggling to find great talent at the moment. And if you do what you've always done, you'll get what you've always got. So we need to look elsewhere and learn how to do that. Can we use tech to recruit and attract great talent? I would say the answer is yes. You've just got to find it. So I think there's some of the things that we want to be thinking about when it comes to the future of tech. I also think ignorance is no longer an excuse, right? And we mentioned the cloud that's up there at the start of this talk. The cloud is interesting. We were talking off air about early adopters, late adopters, and I say this a little bit provocatively, but the cloud is becoming old tech. I don't know if you'd agree with that or not, Yianni, but we want to start thinking about progressive, like AI and machine learning and maybe blockchain and VR and AR and these really early stage techs, because the cloud, maybe old tech is a bit of an exaggeration, but it's certainly established tech. So we've got to learn. Ignorance is no excuse. We've got to learn about VR, AR, AI, blockchain, these sorts of things.
Robotics.
Yianni, what do you? Yeah, robotics, exactly, and on-demand 3D printing, etc. Yianni, what do you reckon?
Yeah, look, I won't get into a technical discussion around what is cloud, but I'd come back to what I said earlier. What do you need to do for your clients and for your team? Why? And then figure out how. I think it's very easy to say let's AI it, let's VR it, let's throw tech at it, but that's a how-led discussion as opposed to a what and why-led discussion. So I think healthcare, the future of healthcare is going to be driven, I think, in a hybrid way. We're going to evolve the model of one-to-one in-person healthcare for every interaction to something that is asymmetric, that's going to be in-person and distributed. And so we're going to need to be able to build out the concept of a virtual clinic that allows not just patients/clients to be supported and served remotely, but also to be able to build a team around you that is also capable of being a remote team as well. So that we sort of break down that four-wall model, this kind of physical clinic type idea, not to get rid of it. I don't think that's the future of healthcare. I think in-person stays the whole way. We don't disrupt that because there's a lot of there's a lot of need in healthcare for people to actually interact with other people. Having said that, there's also a lot of perhaps over-servicing in person, that can be automated and set up with the technology supported by AI, supported by interface tools such as VR, potentially, and other things like that, because it just makes sense to be able to roll that kind of virtual healthcare clinic, but it all needs to be integrated seamlessly as well in the process. I think what I see as the future is a hybrid healthcare delivery model that takes the edge of your clinic all the way into your clients' lives, wherever they happen to be, anywhere, anytime. And some of that is done in person, some of that's done digitally. And then your team is also having the same experience on the other side. So, and I see that being a big antidote to the recruitment challenges that are in the industry at the moment.
Yeah, I totally agree with you, Yianni. Now, just to let everyone know the results of the poll, I will share the results here. We're predominantly OTs, so happy OT day, everyone. We have knocked it out of the park with OTs being here. And then we've also got a really good mix of everyone here, from therapists to practice owners. Everyone's here, so that's really cool. I love that we've got a breadth of humans in this call. Now, I know we've only got a couple of minutes left before we close out. I think from that recruitment piece and sort of where we're leading to, and what I'm seeing in the tech space as well, is how do you leverage technology to bridge that gap, right? Because the rate of diagnosis, especially in early intervention, is going like this, and there's only really a steady incline of therapists that are coming into the market. Some stuff that I've seen that I think is really cool, I think around the rehab, the VR rehab stuff that you can embed in someone's home. There's companies, there's an Australian company called Physio, awesome plug, they're awesome guys. They've got sensors that people put on their bodies to do their physio rehab and things like that. And then there's, oh gosh, there's so many. There's a company in the US called MindMaze. There's lots doing VR tech stuff. I saw another one the other day. It was a robotics tool that someone could put in their home, and it was a robotics companion. So it was an AI bot that had like they call it sentiment analysis, and it could read emotions, and it could suggest to an older person some activities that they could do at home so they didn't feel so lonely. From an OT, I thought that was an awesome tool that they could embed. So I think there's a lot of things that are coming out that are coming into tech. But again, I want to pull it back to what panelists said. It's about the why. It's about why you need that piece, and then figure out how to implement it. Maybe just before we leave, we've got about a minute left. Maybe in a couple of seconds, I'll go to Mel first. What's your kind of one key takeaway that you want therapists, practice owners, students? I know you are hiring. That's a shameless plug for you. So students, go find Mel. She's a wicked practice owner and someone I would definitely suggest working for. But anyway, one key takeaway for us, Mel, before we sign out, and then I'll go to Jack and Yianni as well.
Thank you for the plug. I think that I think it's about finding the tech that is going to solve the client concern, or that inefficiency in your clinic, or whatever the struggles are, whatever the frustration pain points are, and finding the technology to match that, rather than finding some technology and trying to insert it into your clinic that might not be necessary.
Yeah. Jack, yourself?
A well-known tech founder once said, move fast and break things. And so I'd say move, just move. Like I said, you don't have to go deep end, dip your toe in the water. Momentum builds momentum. Do something.
Yeah. Yianni?
I'd ask the question constantly, how does my healthcare service fit into the lives, schedules, goals and aspirations of my clients and my team? And use that as to circle back to often, and keep refreshing what that idea looks like, what that vision is like, and the right tech will emerge to support that.
Awesome. Oh my gosh, you guys are amazing. I cannot thank you enough for today. It's been super exciting. I've put everyone's contact details up here on the screen. So if you have more burning questions, or if you want to connect with us, I know I'm going to speak for everyone, we're more than happy to connect and share our stories and help you out however we can. And also, if we can answer any more of those questions that there might be sitting in the chat, or that you weren't super comfortable putting in the chat, feel free to find us. My email's there, or find me on LinkedIn. That's an easy place to always find me. I'm always on technology of some kind. And yeah, if there's anything else, any other last minute thoughts that anyone wants to put in the chat, what their biggest takeaway was from today, I'm happy to hear those, and then we'll probably sign out in the next minute. Awesome. Thanks, guys. I really appreciate all of your time, and yeah.
Thanks for hosting, Laura. We really appreciate you pulling your run together. I
done,
noticed
Laura.
someone mentioned in the comments around wearables as tech. We didn't get to cover that much today, but for those astute playing along at home, you might have noticed my Whoop band, which is a HRV and sleep tracker. So it's a really good distinction. We often talk about the invisible tech that's in the cloud, but some of those practical wearable things are really useful.
Yeah, awesome. Oh my gosh, we could probably talk about this for hours. Maybe in the chat, if you want us to dig deeper or dive deeper into things, I'm sure I can pull these guys together again to have this chat and to dig deeper into more technology or more practical things. If there's anything we've missed in this, put it in the chat or reach out to us. But for now, we might say goodbye. We've got a practice to run, we've got practices to run, and we've got tech companies to run. So I'll let you guys jump off, and have a good day, everyone.
Thanks. Bye.
Thanks,
See you
everyone. Have a
later.
good day.
Bye.